Every child and young person has the right to be safe and protected from abuse and harm. In the past, some children and young people were hurt by adults other than their parents in places where adults were supposed to look after them and keep them safe. These included places like schools, sports teams, holiday camps, orphanages and detention centres. Children and young people in residential care were harmed by carers and workers, by each other, and by outsiders. To find out why children and young people were harmed and what should have been done to keep them safe, the Australian Government set up a Royal Commission in 2013. Royal Commissions look at big problems. People can talk about what happened to them, and the commissioners investigate how well adults and institutions responded to their experiences. Their job is to find out why these kids were hurt, and to work out how to stop it happening again. The Royal Commission also asked researchers to conduct studies to find out more about particular issues and what particular groups of people think. Because they were especially worried about young people in residential care, the Commission funded a study to find out more. The study aimed to find out what children and young people believe makes a residential care unit safe, what safety risks exist for young people in residential care, what young people believe is being done and should be done to keep them safe, and what they believe is being done and should be done when young people are harmed. 27 children and young people participated in this study. We want to thank them for their time and ideas. Here's a summary of the things that we've heard. Children and young people told us that a safe residential care unit is one that is like and feels like home, where you are cared for and feel welcome, where it is clean and inviting, where people watch out for you and you are safe and feel safe, where you are surrounded by trusted adults and peers and the mix is right, where things are stable and predictable, because people aren't constantly changing and you aren't worried that you might be moved, where rules are fair and there to protect you rather than to control you, and where you have some say about your placement and who you live with, what you do and what help you get, and what should be done when things go wrong. Young people told us that often they are not safe and don't feel safe in residential care. They told us about risks from their peers, from workers and from adults outside of residential care. Young people said that they were often bullied, harassed or physically hurt by others in residential care. Sometimes this was sexual, when young people felt pressured into doing things that they didn't want to do or felt uncomfortable with other people's behaviour. Young people did not believe that they were at risk of being hurt by residential care workers, but they did tell us that sometimes workers were creepy, that they said or did things that didn't seem right or didn't do enough to protect them from harm. Young people were sometimes hurt or manipulated by adults outside of units who took advantage of the fact they lived in residential care. They felt that more needed to be done to protect young people in care from being hurt by these adults. Even when young people were not directly harmed, they told us that seeing others being hurt had a big impact. It's hard to see someone being mistreated or in pain, or who is lashing out, and young people wanted workers to do more to help. Young people gave us ideas on what should be done to make residential care safer. These included keeping most children out of residential care, particularly if they're little or can't protect themselves. Finding safer models of care for young people who can't be returned to home or put into foster care. Spending more time deciding who is placed together and giving young children and young people a say about this. Making sure there are good, trustworthy and skilled workers around. Every child and young person in care needs someone they can trust. Keeping up to date about things that can harm children and the best ways to identify risks. Telling children and young people about these harms and how they can protect themselves. providing lots of opportunities for children and young people to have their say and raise concerns. Making it clear to all young people and staff about what is and isn't expected in residential care. Watching to make sure that adults and young people are doing the right thing and stepping in when they're not. And acting like a parent, protecting young people when they're being harmed. Staff and trustworthy adults were seen as vital to keeping children and young people safe. Safe staff were ones who you could go to when you were worried. Who constantly ask, "Are you okay? Do you feel safe?" Who listen and show that they care. Who take your fears and worries seriously. Who stand up for you, particularly when you have a complaint about another adult. Who work with you and give you a say about how they deal with any problems that arise. Who tell you what they've done to keep you safe or deal with your concerns. There were a number of reasons why young people were not always helped when they were harmed. Sometimes they didn't feel that they could tell anyone about being hurt because they didn't know who to tell. They were worried that things would get worse. They thought adults wouldn't believe them, or they weren't confident that adults would deal with the issue effectively. They said that they were more likely to rely on a friend or deal with it themselves. Young people needed adults and organisations to prove to them that they took their safety seriously and had things in place to protect them from harm and respond when problems arose. Residential care often isn't safe for children and young people, who told us that it needs to be greatly improved. Children and young people need adults and institutions to take their safety seriously, to care about young people and prioritise their protection, and to make sure that residential care services work with and for children and young people to find solutions to safety issues. Ensuring that children and young people each have a trusted adult who is available to them was seen as an important first step, as well as talking to children and young people about their fears and concerns and giving them ideas about how they can protect themselves and each other. Every child and young person needs someone to fight for them and to step in when they're being harmed.